Hi everyone, this is Sandra Horace, and this is my DNP dissemination PowerPoint for my project, Efficacy of Handoff Education for ICU Nurses when Transferring Patients to the Operating Room. The faculty chair for my project is Dr. Douglas Stevens. So this project started with a needs assessment, which is a survey of 30 of the surgical ICU RNs, which found that only 16% knew how to execute the current preoperative handoff process when sending patients to the OR. The transition period from the surgical ICU to the operating room is a hugely important process, but it's also a time when the patient is very vulnerable and at risk for omissions of important information. So this project aimed to provide handoff education for the surgical ICU nurses utilizing the IPASS method of handoff to improve ICU to OR handoff. The project aimed to increase awareness and use of handoff among SICU RNs. The objective of teaching IPASS handoff to RNs and seeing a measurable difference in knowledge following education was set. And this was also accompanied by a goal of increasing reported handoff. Several means of educating the RNs to bring awareness of the process to the surgical ICU nurses were utilized. The PICO question in this project was, in patients transferring from the surgical ICU to the operating room, does the education of SICU RNs about the handoff process increase awareness and use of handoff compared to no education? The theoretical framework used in this project was Kurt Lewin's change management theory. This includes the unfreezing, change, and freezing process. The unfreezing process is the recognition of a need for change and finding modes of making change possible. And the change process is also known as the movement process. And in this process, the change is implemented and a more productive means of accomplishing goals is realized. And the refreezing process involves making this change a new normal. The literature review for this project includes evidence suggesting that preoperative handoff occurs 25 to 50% of the time. There is a lot of information out there regarding handoff itself. Handoff in the preoperative setting is not as widely studied. That said, there's some information to be found. It has been estimated that as many as 80% of medical errors occur due to a breakdown in communication. Surgical ICU patients have a lot of equipment. There is a volume and a lot of intricacies in the information that needs to be presented. The patient's physical condition can also create a more complex environment for the handoff process compared to an outpatient who is coming in and has no equipment, no drips, no rapidly changing situations. The SICU patient frequently has multiple issues occurring simultaneously. All of these can be problems when we're talking about handoff and the opportunity for missed pieces of information. The number of providers present for the handoff process can also lead to a less organized process with more interruptions. During a SICU to OR handoff, there can be as many as 6 to 10 providers in the room. This can include the ICU nurse as well as the OR nurse, the anesthesiologist, the intensivist, the respiratory therapist, transport personnel. There can sometimes be residents in the room. There can be CRNAs in the room as well. And this can lead to many opportunities for interruptions, as well as many people having unclear roles about what their role is. So the IPASS method of handoff itself, which was educated for this project, which is what the RNs were educated on for this project, is a mnemonic, and the mnemonic stands for illness severity, patient summary, action list, situational awareness and contingency planning, and synthesis by the receiver. Regarding the design of this project and this implementation, in-service education was used to educate the sick URNs about the IPASS method and also the need for effective handoff. And this intervention was evaluated using pre- and post-intervention tests, and that was used to determine the effectiveness of the education. Implementation itself followed the Plan, Do, Study, Act, PDSA, method of implementing change. So the planning phase probably was the longest phase, including the needs assessment, literature reviews, IRB approval, meetings with the stakeholders, development of the intervention itself. The Do phase included the implementation of the educational intervention. The study phase was the outcome analysis and conclusions. And the Act phase is still in process, and that includes our sustainability measures, which will be discussed later. Outcomes for this project found significant improvement in the pre- and post-education test scores. The pre-education mean was 51.6%, and the post-education mean was 88.7%. Additionally, the sick URNs expressed an understanding of IPASS handoff and the importance of following a structured method during transfer of care. The outcomes of this project have proven that the IPASS method of handoff can easily be taught to sick URNs as a means of improving bedside handoff when patients are sent from the SICU to the OR. The data collected indicates that in-service education is an effective means of disseminating information to surgical ICU RNs. This project for sustainability has been brought before the nurse leadership team at the project site and is being reviewed for implementation across the hospital when patients are being sent from any inpatient area to the operating room. Following this implementation and evaluation, the project is planned to be presented across the enterprise, which owns the facility. So this eventually may be an enterprise-wide intervention, and it certainly is going to become a hospital-wide intervention. Acknowledgements. This project would not have been possible without the support and encouragement of my family and friends. My mother, who passed away 3 years ago, was my biggest cheerleader. And following her death, many members of my tribe picked up her mantle to love and encourage me. And this whole project, I dedicate completely to her and to her spirit that still is giving me the love and encouragement I need. The faculty and staff at JSU have been very supportive and very active in the creation and development of this project. Their patience and gentle encouragement have made this possible and have kept me on track throughout the project. Also, the facility where the project was implemented has a hugely encouraging leadership team. And the nursing team, as well as the leadership team, accepted ideas and suggestions openly, and they really helped this project become what it is. I'm truly grateful for everyone who has had any part in assisting, encouraging, mentoring, or just supporting me throughout this time. And here you will find references. Thank you very much for taking the time to listen. I hope y'all have a great day.